Adalimumab, also known as Yuflyma, cf. 40 mg per 0.4 ml subcutaneous syringe kit. Inflammatory bowel agents, is used to reduce pain and swelling in certain types of arthritis, skin disorders, certain bowel conditions, and a certain eye disease. It works by blocking a protein in the body's immune system that causes joint swelling and damage in arthritis as well as red scaly patches in psoriasis. By reducing joint swelling, this medication helps to reduce further joint damage and preserve joint function. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. Before you start using Yuflyma, cf. 40 mg per 0.4 ml subcutaneous syringe kit, it's important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional and the product package. Before using, make sure to check the product visually for particles or discoloration. If either is present, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. It's important to use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition lasts or gets worse, make sure to tell your doctor. Some common side effects at the injection site may include redness, itching, pain, or swelling. If these effects persist or worsen, notify your doctor or pharmacist. Remember that the benefit of this medication has been determined to outweigh the risk of side effects. Many people using this medication do not experience serious side effects. Notify your doctor immediately if you experience signs of infection such as a persistent sore throat, cough, fever, chills, night sweats, difficulty breathing, painful or frequent urination, unusual vaginal discharge, or white patches in the mouth. Seek prompt medical attention if you experienced serious side effects such as irregular heartbeat, symptoms of heart failure, blood in the stools, mental/mood changes, severe headache, easy bruising/bleeding, leg pain/swelling, numbness or tingling, unsteadiness, muscle weakness, difficulty with speaking/swallowing, vision changes, joint pain, or a butterfly-shaped rash on the nose and cheeks. Adalimumab may rarely cause serious liver disease. Your doctor may order blood tests and monitor for symptoms of liver damage. Seek immediate medical help if you experience symptoms such as persistent nausea/vomiting, loss of appetite, abdominal pain, yellowing of the eyes/skin, dark urine, seizures, or chest pain. In rare cases, a serious allergic reaction may occur. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. This medication can lower your body's ability to fight infections, making you more susceptible to serious infections such as fungal and bacterial infections, including tuberculosis. Be sure to inform your doctor of any past, recent, or current infections, as well as any travel to areas where certain fungal infections are common. Your doctor will test you for tuberculosis before and during treatment with this drug to prevent a serious infection. There is also a small risk of developing cancer, especially in children, teens, and young adults, so it's important to discuss the risks and benefits with your doctor. Be sure to notify your doctor if you experience symptoms such as fever, unusual lumps or growths, swollen glands, unexplained weight loss, or night sweats. Before using Yuflyma, it's important to inform your doctor about any allergies you may have or if you have a history of certain medical conditions such as infections, blood or bone marrow problems, seizures, cancer, heart disease, or autoimmune disorders. Yuflyma may increase your risk of developing infections, so it's important to avoid contact with individuals who are sick, and to inform your doctor if you have been exposed to any infections. It's also important to inform your healthcare professional before receiving any vaccinations, and to use caution with sharp objects and activities that may cause injury. Additionally, it's important to inform your doctor about all medications you are taking, including herbal products, and to discuss the risks and benefits of using Yuflyma during pregnancy or while breastfeeding. It's important to be aware of potential drug interactions that could affect how Yuflyma, CF, 40 mg per 0.4 ml subcutaneous syringe kit works or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include other TNF blockers, such as etanercept, Infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Be sure to discuss any concerns with your healthcare provider to ensure the best possible outcome. If you suspect an overdose or experience serious symptoms such as passing out or trouble breathing, seek immediate medical attention by calling 911 or your local poison control center. In the U.S., residents can call 1-800-222-1222, while in Canada, residents can call a provincial poison control center. It is important not to share Yuflyma, CF, 40 mg per 0.4 ml subcutaneous syringe kit with others, as it is prescribed specifically for your condition. Your doctor may recommend lab and/or medical tests, such as a complete blood count and liver function tests, while you are using this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. When taking Yuflyma, CF, 40 mg per 0.4 ml subcutaneous syringe kit, it is important to follow your doctor's instructions regarding the daily dosage and the optimal timing for taking the medication. If you forget to take a dose, it's important to speak with your doctor or pharmacist to figure out when to take the next dose. Do not take a double dose to make up for the missed one. When storing Yuflyma, CF, 40 mg per 0.4 ml subcutaneous syringe kit, make sure to keep it in the refrigerator, but do not freeze it. Some brands may be stored at room temperature, so check with your pharmacist or read the product package for specific instructions. Once it has been stored at room temperature, do not put it back in the refrigerator. Keep the medication in its original container to protect it from light and discard any unused portion. Remember to keep all medications away from children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it expires or is no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.